Hello beautiful people, welcome back to my YouTube channel. If you're new to this channel, my name is Vimal Thomas. I'm a 4th year medical student from TSMU, Georgia. And today's video is going to be everything you need to know about PLAB. So let's get into the video. Important note, PLAB will be replaced by UKMLA in 2023. It also has two parts. The first part is AKT, which is Applied Knowledge Test, which is similar to PLAB 1. Second one is CPSA or Clinical and Professional Skill Assessment, which is similar to PLAB 2. So the first criteria we will look into is eligibility. You can only sit for PLAB exam only after completing your medical school, unlike USMLE, in which you can take your exams in between medical school. So to apply for PLAB exams, you need two requirements. The first requirement is evidence of English language proficiency. So there are several ways to prove your English language proficiency like IELTS and TOEFL. And the second point is a medical degree which is acceptable in UK. So you can check, or your qualification must be awarded by an institution listed on the World Directory of Medical Schools. You can check whether your qualifications are acceptable before you start the application process. Second point is structure of PLAB exam. There are two parts for PLAB exam, PLAB 1 and PLAB 2. PLAB 1 is of MCQ questions, multiple choice questions, 180 questions and 3 hours of time. PLAB 2 is OSCE. OSCE means Objective Structural Clinical Examination, Structured Clinical Examination. It is basically to test your clinical skills and performance in day-to-day life. And it is made up of 18 stations, each lasting for 8 minutes. The third point is preparation time. It only takes 3 to 4 months to prepare for PLAB 1 and PLAB 2. But you should be dedicated and should revise consistently. Without hard work, there is no success. Most of the students study PLAB in their internship years. They start PLAB in their internship years. PLAB 1 is theoretical knowledge and PLAB 2 is clinical exposure. So during your internship period, you get exposed clinically. And it will be challenging because of the time, but if you manage your time, you are gonna see success in no time. The fourth point is expenses. PLAB 1 will cost you around £240, whereas PLAB 2 will cost you around £875. The fifth point, exam centers. PLAB 1 can be taken in UK or in any international centers around the globe. You can take it in Dubai, Egypt, India, Bangladesh, Australia, Pakistan, South Africa, etc. But PLAB 2 it can only be taken in UK. It will be conducted in the GMC's Clinical Assessment Centre in Manchester. GMC is the General Medical Council, which is a public body that maintains the official register of medical practitioners within the UK. Important note, you must pass PLAB 1 before taking PLAB 2. You should pass PLAB 2 within 2 years you pass PLAB 1. The sixth point is number of attempts. You can attend PLAB 1 and 2 4 to 5 times, but normally candidates pass within first or second attempt. The seventh point is questions. You won't be tested. They won't ask you what is the name of this muscle, what is the name of that artery or something like that. The questions will be based on clinical skills or clinical practice. Don't worry, unlike US licensing exams, PLAB scores does not matter. You just have to pass and you are eligible to apply for GMC registration. The eighth point is study materials. So this exam, PLAB 1 exam, tests your ability to apply knowledge to the care of patients. It does not test how well you can remember and recite the facts. What does the exam cover? So basically the exam covers the common, important or acute conditions, or those that are common in emergency departments seen by trainees entering the second year of foundation program, and the management of long-term conditions seen in primary care. The books that are recommended for PLAB 1 is Oxford Handbook for the Foundation program. PLAB 2. It will be better if you attend a course prior to PLAB 2, and most commonly these courses are found in UK, but there are also some international PLAB 2 courses. So how to choose your coaching centers? Try to choose the coaching centers which contain small study groups and the coaching centers which gives more and more amounts of mock tests. In PLAB 2, doctors will examine you based on certain criteria. The first one is clinical examination. The examiner will assess you on your ability to conduct a physical examination of a stimulated patient. This will be an actor who is trained to display signs when required. Second one is practical skills. The examiner will assess you on your ability to perform common practical procedures like checking blood pressure, giving intravenous injection, suturing, etc. The third one is interpersonal skills. They test these skills by observing the interaction between you and the patient. This may include explaining diagnosis, investigation and treatment, communicating with relatives, communicating with health professionals, and breaking the bad news. I hope you guys like the video. If you like the video, give it a thumbs up and subscribe for more content. Bye bye.